and control basic car functions.
Dr. Shad Morris is in studio with us from Premier Sleep Solutions. We're talking about these great oral appliances, and we compare them to CPAPs, but one of the things I like about you, Dr. Morris, is you're quick to say there are people out there that like their CPAPs, and we hear from some of those people from time to time.
Oh, yeah, and it is. The CPAP is a great thing if you can tolerate it.
Exactly. So, yeah, the 30% who can tolerate it and use it, don't change what you're doing. Keep doing it because it works, and it works great.
Yeah, but your hope is that with this oral device, you can help the other 70% out there that struggle with it and can get a good night's sleep, which is not just going to make you feel better in the morning. It's going to help you health-wise for a long, long time.
I think oftentimes we don't realize we're suffering until we get the fix. And so many patients we've been able to then help that's changed their lives dramatically. That's why we have them journal down the changes, because sometimes as you progress, you get better and you forget. So it's very dramatic.
And when you do the sleep study, I did the sleep study to find out if I had sleep apnea, and you find out just how poor your sleep is. And this is not just something that affects people who are overweight. It affects all kinds of people, all kinds of ages that have sleep apnea.
If you could say the 10,000 patients that we treated, it's all shapes, forms, sizes, genetics, and gravity being the two biggest causes of it. They're out of your control. So this is something you don't have control over if you do have sleep apnea, but there are several ways, and I think that's what's great about us is we go over all the four main ways to treat this, including the CPAP as well.
It's interesting. Today's 9/11. We're talking about first responders, and for whatever reason, you treat a lot of first responders, right?
Yeah, I can't think of anybody else who needs their sleep more. We need to be more sharp on the job than our first responders, right?
And so I'm grateful personally for what you did for me, Doctor, and I encourage anyone to get in there and check it out. And by the way, insurance covers this.
You know this, yes. So medical insurance covers this dental procedure. We're dentists, but it's a little system that we figured out, and we'll be able to help a lot of people change their lives.
It's so easy to sleep with you. Pardon me, Tim.
Yeah. For the first 25 callers, you're going to get a free consultation today. So let's give them the number. It's 385-24-SLEEP, 385-24-SLEEP.
And we'll talk to you again in a moment. Dr. Shad Morris from Premier Sleep Solutions, premiersleepsolutions.com.